Good morning, everybody. Today's class is about a very important topic by name deglutition, which is nothing but swallowing. Before swallowing, you should know there are some movements in the gastrointestinal tract. These can be either propulsive movements or mixing movements. The movements which propel the food along the gastrointestinal tract, as you all know, the basic propulsive movement is peristalsis, which is a reflex response that begins when the gastrointestinal wall is stretched by food due to mechanical distension in the lumen. It occurs throughout the GIT from esophagus to rectum. Peristalsis occurs at a rate of 2 to 25 cm per minute. It consists of a ring of contraction in one segment, and there is a dilatation or receptive relaxation in the immediate distal segment. Apart from gastrointestinal tract, peristalsis occurs in ureter and bile ducts. The stimulus for peristalsis is mechanical distension. The distension stimulates the gut wall and contractile ring appears, which initiates peristalsis. It is brought about by myenteric plexus. It occurs only in one direction, from the esophagus towards the rectum. The occurrence of peristalsis and its movement towards the anus is termed as the law of gut. The second, after the propulsive movement, is the mixing movements. The mixing movements are caused by either of the peristaltic contraction or local constriction of small segment in the GIT. These constrictions last for few seconds. Among this, as soon as you consume food, the first basic thing is you start chewing. Chewing is also called as mastication, which is a process by which food particles taken into the mouth is crushed into small particles by grinding action of the teeth. The incisors and canines, which are the anterior teeth, help in cutting action, and the posterior, the premolars and molars, provide the grinding action. The muscles of mastication are innervated by trigeminal nerve. It is controlled, the mastication is controlled by nuclei in the brainstem. There is also chewing reflex. The presence of food in the mouth causes reflex inhibition of muscles of mastication. The muscles of mastication are medial and lateral pterygoid, the masseter, causing the lower jaw to drop. This activates the stretch reflex of muscles, resulting in contraction. The jaw is raised to cause apposition. As you all know, when you start chewing, these are the processes which happens, and compression of the bolus. The compression of the bolus inhibits contraction of the jaw muscles and process is repeated. So mastication helps in increasing the surface area of the food by breaking it to small particles, which enhances or helps in better digestion. The grinding action prevents excoriation of GI tract and increases rate of emptying of food from the stomach. So we have come across two types of movements: the propulsive movements, which include the peristalsis, which is based on law of gut, and the mixing movement. Mixing movement, we have mastication followed by deglutition. Deglutition is also called as swallowing. The process of food passing into the stomach from the mouth is called as swallowing or deglutition. Per day, you tend to swallow around 600 times. It is a reflex mechanism. The food passes from the mouth through the pharynx, esophagus, and enters the stomach. There are three phases. Before that, you should understand the pharyngeal muscles will help in swallowing. The pharyngeal includes the constrictors, the superior, inferior, and middle constrictors, and the palatal muscles, which is there. Esophagus, you all know, connects the pharynx to the stomach. It's a muscular tube which measures around 25 to 30 centimeter, helps in passage of food. It begins at the cricoid cartilage, passes through the mediastinum, through the diaphragm, and finally into the esophageal hiatus. It meets the stomach through the cardiac orifice. Cardiac orifice is a muscular lower esophageal sphincter which closes the area. So you can see the stomach and the general structure. The esophagus is a 25 centimeter tube. So we will be dealing about a very important reflex, which is a spinal reflex, which is swallowing reflex, which is called as deglutition, which helps the chewed food after mastication to pass through the pharynx into the stomach via the esophagus. So it has three phases: the oral or the buccal phase, the pharyngeal, and the esophageal. The oral is voluntary, it is under your control, whereas the pharyngeal and esophageal are involuntary, which cannot be stopped. So the oral phase, in this which is voluntary, the food present in the mouth is converted to a bolus by the process of mastication and is mixed with saliva. Later the food is pushed backwards by the pressure of the tongue against the palate. The tongue collects the bolus, presses against the palate and pushes back to oropharynx. This is the first phase, which is voluntary. What is the phase called as? Buccal phase. The second is the pharyngeal phase. Here the bolus stimulates the tactile receptors in the pharynx, which initiates swallowing reflex. What happens in swallowing reflex? The soft palate is raised and it blocks the nasopharynx, which prevents the entry of food into the nasal airs and the root of the tongue blocks the oral cavity. Larynx pulls up, the epiglottis is covered, the opening of the epiglottis is covered, the vestibular folds adduct and closes the airway, or otherwise when the food passes into the larynx, there can be sneezing. That's the reason you are not supposed to talk while eating. The constrictors of the pharynx push the bolus downward into the esophagus and triggers the propulsive movement, which is the peristalsis. So once again, in the pharyngeal phase, as the food enters the pharynx, a series of changes occurs to allow the food to pass through pharynx. The soft pelvis is raised to close the posterior nares so that the food does not enter the nasal cavity. The palatopharyngeal folds are pulled medially to form a small slit which allows the masticated food to pass through it. The vocal cords are coming close together, which is they are adducted together. The hyoid bone and the larynx are pulled upward and anteriorly by the neck muscles, causing the epiglottis to swing back over the laryngeal opening. This prevents the entry of food into the trachea. The opening of esophagus stretches the upper esophageal sphincter, which relaxes, allowing the food to pass down the esophagus. Normally, this sphincter is strongly contracted so that air does not enter the esophagus during respiration. At the same time, the superior constrictor muscles of pharynx contracts, giving rise to rapid peristaltic wave which passes down the esophagus. As you can see, the food is closed. Soft plateau closes the nasal cavity and passes through the pharynx, and the epiglottis is closing the laryngeal opening. The entire process occurs in 1 to 2 seconds. During this period, the respiratory center of the medulla are inhibited, causing interruption of respiration. So when you are swallowing, there is no respiration. The respiration is stopped or inhibited for 1 to 2 seconds. This is called as deglutition apnea. So you can see in the first step, tongue pushes the bolus against the soft palate and back of the mouth, triggering the swallowing reflex. The upper esophageal sphincter relaxes while epiglottis closes the laryngeal opening to keep the swallowed material out of the airways. The last phase, the first was the buccal, the second is pharyngeal, the third is the esophageal phase, which is also involuntary. The esophagus produces a series of local reflexes in response to mechanical distension of the wall of the GI wall by bolus. Wave-like muscular contraction pushes the food down to esophagus no matter the position of the body, whether it can be lying down or standing. Liquid takes 1 to 2 seconds and the bolus takes 4 to 2 seconds. The first step is, so there are two types of muscle, the longitudinal and the circular muscle. Contraction of circular muscle behind the mass, which is the constriction, and it is passing from aborally towards the anus. Second is contraction of the longitudinal muscle ahead of the food mass. Step 3 is contraction of circular muscle forces the food forward. So you can see the esophagus conducts the food from the pharynx to the stomach. It exhibits peristaltic movements, the primary peristalsis and secondary peristalsis. The primary peristalsis is the continuation of peristalsis from the pharynx, which causes movement of food in 8 to 10 seconds. You can see the longitudinal and the circular muscle which initiates the peristalsis due to the bolus, which causes mechanical distension. As we have seen, the primary stimulus is mechanical distension. The secondary peristalsis is movement of food not propelled by peristalsis. As the food reaches the lower esophageal sphincter, there is relaxation of the stomach and sphincter to receive the food. This term is called as receptive relaxation. So deglutition, so the lower esophageal sphincter is tonically active. It relaxes on swallowing. That's how the food enters the stomach. It is mediated via nitric oxide and massive active intestinal polypeptide. The tonic activity prevents reflex esophagitis. So you can see tongue pushes the bolus against the buccal. The upper esophageal relaxes while the epiglottis closes, so preventing the food to enter the airways. And finally, the esophageal phase, the food moves downwards into the esophagus, propelled by peristaltic wave and aided by gravity. So how is it regulated or controlled? It is a reflex response. The presence of the food in the mouth causes stimulation of tractus solitarius of the medulla through fifth cranial nerve, that is the trigeminal nerve, the ninth, the glossopharyngeal cranial nerve, and the 10th, vagus cranial nerve, which are the afferents. The center is, where is the integration center? It is the nucleus tractus solitarius of the medulla. And the information is processed here along with nucleus ambiguous, and the information is coming out of the central nervous system, that is from the medulla to the pharyngeal muscles and tongue via the fifth, the trigeminal, the seventh, the facial nerve, and the 12th, the hypoglossal cranial nerves. So there is an afferent, the information which carries to the brain, and there is the center in the brain, that is the medulla, the nucleus tractus, and the information is processed and it comes to the muscles of the deglutition, which helps them, or the pharyngeal muscles, and to the tongue via the, so this is the regulation. There is a deglutition center which is present in the reticular area of upper medulla and lower pons. It consists of nucleus tractus solitarius and nucleus ambiguous. The motor impulses arising from this area bring about swallowing by constricting the pharyngeal muscles. So the sensory information is converted to the brain by 5th, 9th and 10th cranial nerve, whereas the motor information impulses are helping constriction of muscles, which enhances swallowing. So what are the disorders? It can be achalasia cardia. In this condition, the lower esophageal sphincter fails to relax during swallowing. There is excessive dilatation of esophagus. This is due to increased resting lower esophageal sphincter tension. There is incomplete relaxation, decreased vasoactive intestinal polypeptide, food accumulates in the esophagus and organ becomes massively dilated. This is rat tail appearance. It can result in gastroesophageal reflux disease. There is also bulbar paralysis. In bulbar paralysis like poliovirus, the food regurgitates through the nose, or there can be paralysis of the laryngeal muscles. Here, the food enters the respiratory tract, causing suffocation and death.